Welcome to BCAT's Health Beat Brooklyn. I'm Dr. Monica Sweeney. This month, AIDS, a disease that points up both our victories and our failures as a society. In a relatively short time, science has done a great deal to bring the illness under control. Yet too many people are still contracting HIV, the virus that causes AIDS. Despite the fact that plenty of condoms, clean needles, and educational resources are out there. In 2005, Brooklyn had more people diagnosed with HIV than any other borough, and 666 of them died. That's why HIV testing is such a critical part of the battle. Here's a look at some of the frontline troops. Moving through the streets of Brooklyn aboard a mobile medical unit, these women prep for the day's work. They're members of an almost 20-year-old effort called Project Street Beat, a program run by Planned Parenthood of New York. Program director Cliff Brown waits at the morning's location on Chauncey Street off Broadway, right where Bed-Stuy borders on Bushwick. The Eddie Harris Residential Facility is a co-ed, city-run shelter the team visits almost every week. Today's goal? To administer as many HIV tests as possible. Jasenia Cassiano starts off with Tamika.
Thank you. So I'm going to ask questions. We're going to sign some papers. Project Street Beat is an outreach organization that goes out in the street to try to reduce the transmission of HIV amongst the community that we service.
To Jessie and her co-workers, HIV/AIDS is a potentially lethal public health threat. But these days, at least, the general public is better informed.
Before we had to do a whole extensive pre-test counseling, and now we've gone to streamline because we do have people that know about HIV, know about HIV testing, and are more knowledgeable now as far as that goes. You know, they are taking care of themselves better and, you know, just being concerned about HIV testing.
You're going to take this, you're going to pick your upper lip, you're going to start from the back, rub it all around your gums to the end.
For one thing, many people know that getting tested is now easier and faster than ever, thanks to the oral swab. No syringe, no blood, results while you wait. Though if it's positive, you will need a follow-up blood test.
Oral Quick Advance has definitely helped. At one point where it was blood, and they had to wait 2 weeks for their HIV testing. You had a lot of people that weren't coming back for their results, and or were scared to find out the results, or were scared of needles and didn't want to take the test. This test, you will get your results back in 20 minutes. It does test for HIV 1 and 2.
About 4 miles away, this is Lutheran's Caribbean American Family Health Center. Inside, the same test is about to be given.
The difference between HIV and AIDS is HIV is the virus, AIDS is the disease.
The center's medical director, Dr. David John, knows the benefits of the oral swab, also called the rapid test.
It's an easy thing to do. It's not invasive. It's not probing. People stay away from testing. A lot of them, some people by culture just don't like to be stuck. The fear of a needle alone is something that keeps them out of a doctor's office. You tell them it's a swab, and you know it makes it so much more relaxing, so much easier to do. So we have seen a big increase in rapid testing.
The rapid test is also considered to be very reliable.
The negative, it has a high sensitivity and a very high specificity. For every 1,000 tests that are done, you may have 4 of them which may be falsely positive. So that's a pretty good test.
You test positive, I'll need to draw blood to do a confirmatory test, which is called a Western blot test, right? This test takes 20 minutes and is 99.6% accurate.
But progress in testing in no way diminishes HIV/AIDS as a major problem, especially in the central Brooklyn community served by Dr. John's clinic, an area with close to the highest incidence of HIV/AIDS in the city.
In 2004, New York City Health Department released some figures based on demographics. And we were looking at new HIV infections in New York City. And we looked at them in terms of which countries did they come from. And the amazing thing was the highest numbers came from the Caribbean, 350 cases. I think the problem in Brooklyn, particularly central Brooklyn, is that we do have a lot of immigrants here, people who come in from resource-poor places that do not have access to antiretrovirals and do not have testing available, and who have the challenges of stigma. Stigma in terms of the Caribbean population is tied to people losing their jobs, is tied to people losing their homes, is tied to people going into poverty. You will have someone who's married and who still engages having sex with men. Married to keep that public safe face, but having sex with men because that's the lifestyle they choose.
Hello, and thank you for calling STFree.
Telling the truth about your sexual health is the idea behind the Safe Sex License. Its inventor, Eli Dancy, says his company, STFree Certifications, has 13,000 subscribers.
It's a confidential card that instantly allows the individual to prove the last 2 times they were tested for HIV and various other STDs, depending upon which card you get.
It works this way. Register at the Safe Sex License website, pay a modest lifetime fee, and go get yourself tested.
So once we receive that information that they went and got tested, we get that back in our offices, it's verified, it's authorized, it's uploaded to their account, and their card is activated.
But even though a cardholder can prove to a potential sexual partner that he or she had a negative result on a certain date, it can't certify what's happened since then. This has to do with the window period during which an infection is said to convert and become transmissible.
Someone can convert as quickly as 3 weeks. So I would be very concerned about any license that allows people to be tested twice a year or even 3 times a year and give them a license to have safe sex.
Dancy freely admits his card can only verify a clean bill of health up to a point, and the company urges subscribers to take precautions.
STFree encourages the use of other STD prevention methods, such as condoms, in conjunction with our service.
He compares the Safe Sex License to a sexual credit check.
Someone can be found negative yesterday, had engaged in, unsafe activity tonight, and, be positive, so there's no way to really guarantee, but this gives you a better idea of that person. So this is a great icebreaker, and it's also a great way to show somebody, without putting too much information out there that, look, I do go get tested, I do care about my status, I know my status, and, I think you should too.
Back at the Eddie Harris Center, Project Street Beat continues its HIV testing. To accommodate as many people as possible, the team even uses its minivans.
What's your first name?
Desiree.
Desiree?
Mm-hmm.
The numbers show that in New York City, minority women make up more and more of the HIV population.
What we're seeing is more incidents of young females, not knowing about HIV or, not having the confidence to talk about condoms in their relationship.
Meanwhile, the 20 minutes are up for Tamika's test result.
Okay, Tamika, your results have come back, and right now the results are saying negative, okay, which is a non-reactive. Mm-hmm. Okay, how you feel about that?
I feel good.
I see that more people are learning about HIV and are more comfortable with getting HIV tested than they were in the beginning, but we still got a lot of work to do.
As always, the session ends with the HIV counselor's constant refrain.
So just make sure you keep using condoms. We're going to give you a whole bunch of condoms.
Okay.
You can keep coming back to us and getting tested if you want to come. Bring you the Metropolitan. Okay?